Hi everybody and welcome back to my channel. I wanted to give a bit of a life update. I can't really remember what I put in my last few videos, but I think one of the last one was talking about going to get a diagnosis for Tourette's. So I wanted to talk about what was happening with that. So to start off with, I went to my GP and asked to be referred for assessment. And so they put that through really quickly. And so they sent me. I got an assessment with in the psychology department. And I went to see a doctor there. I'm not really sure what she specialised in. But she didn't seem to know a lot about Tourette's and was very uneducated about autism. So at the appointment, we were talking about my history and my symptoms and stuff. And she was like, "Oh right, okay." And she checked my reflexes. And when I mentioned that I'm autistic, she gave that look that you might have gotten if you're autistic as well. The sort of like, "Oh, are you?" type of look, like, sure you are. And then when we were talking about my history, I mentioned I'd gone to college, and she was like, "Oh, you went to college when you're autistic?" I'm like, "Yeah." And she's like, "How did that work?" I'm like, "Autistic people can go to college, you know. We don't all need loads of help and stuff to be able to go. Like, we are capable of going." So anyway, thankfully she wasn't the one doing the assessment. She referred me on to a neurologist who did specialise in Tourette's. So anyway, I got the appointment for that. But in the meantime, they needed me to fill out some paperwork and questions. So I had a nurse, I think, come out to the house to fill out the paperwork, and she was lovely, very understanding. And honestly, I have to say, with the whole Tourette's diagnosis, this is the best curve I had for any of my like diagnosis assessments for anything. They were very understanding, very lovely. Other than the woman who didn't know anything about autism, the nurse who came out, she went through all the questionnaires, filled out all the history, like my past history and everything. And because I said I struggle in appointments, she put through to get me I think an advocate or something. Basically someone who's with you, there with you in the appointment to help you if you get stuck. Because sometimes in appointments, I have a poor memory and I get a bit stuck sometimes, and like I forget to ask questions or I can't remember things. So she was there with me during the appointment, and that was a big help, even just having someone in the room. So then I got the appointment in the neurologist place with the specialist in tics, and we went through all. He asked me like more questions, more about my history and tics and stuff, and was like, "So do you think this is Tourette's?" And I don't know why doctors do this, but they don't give a yes or no answer. They don't say like, "Oh, you have this," and that's it. The guy was the one like, "Well, Tourette's is this," and like he was explaining like the diagnostic criteria for it, and he's like, "With your presentation, we would usually label it as this," and I'm like, "So is that Tourette's?" And he's like, "Well, with your presentation," I'm like, "That's not a yes or no answer." Like, so yeah, eventually I managed to like sort of tease out of him that yes, he was basically diagnosing me with Tourette's. But I don't know what it is with doctors and being unable to just give a straight answer, but it's like they're scared of saying the wrong thing. But anyway, basically, yes, I do have Tourette's. So when I asked him, like, is there any support for it? He's like, well, it doesn't seem like the thing we need to be focusing on right now, because I'd mentioned about my OCD as well. He said, well, I think we should focus on your OCD, and that should fix your tics, or like that should help reduce your tics. And I'm like, okay. So basically, what he said was he wanted to prescribe me some medication. I think he said fluoxetine, I'm not entirely sure. And that he wanted me to have talking therapy to manage my OCD, which I was fine with, because like my OCD is a problem. I don't think it affects my tics, but like I'm not. I was by the end of the appointment. I just wanted out of there. I was exhausted. It'd been like an hour, and it's a lot of talking. So I was just like, yeah, fine, whatever, do anything. That was in December. You tend to find doctors aren't great at doing the jobs that they're supposed to do for some reason. He never sent out the letter to tell my doctor to prescribe the medication. So when I hadn't heard anything, I phoned my GP and was like, hey, I'm supposed to have been getting this medication and talking therapy, and I've not heard anything. And they were like, well, we haven't heard anything either. You've got to contact the doctor who prescribed this and contact them, which I've not done. If you have PDA yourself, or if you know anything about it, you'll know it's incredibly hard to do things like this. I find making phone calls incredibly difficult. It takes me months to work up the ability to do it, and that's even for like regular things like phoning the doctor, which I do quite a lot. So being to like phone up a department that I've not really contacted before and try to explain it all, it's just too hard. I've just not been able to do it. So yeah, I'm just kind of waiting on my ability to phone the doctor to chase up the prescriptions to get the help that I need, which I don't even care. I'm just whatever. Anyway, that was the Tourette's side. The other things that's been going on in my life, I can't remember if I did a video about this, but I had COVID last year. I think it was the middle of last year, I'm not entirely sure. And I did have breathing difficulties before that, but COVID made them like way worse. And I thought like a few months after having had COVID that I would just like get better. And for a lot of things I did, but for the fatigue and my breathing and other things, it just wasn't getting better at all. Then I was diagnosed with ME at was that the start of this year or last year? No, that was last year. No, so I was diagnosed with ME at the start of last year, and then I caught COVID. And so I've not recovered from that. So a couple of months ago, I'd reached the 6-month mark after having COVID, and I still wasn't better. So I phoned my GP again and was like, explain the situation. And they were like, okay, what we'll do is we will send you for a lung x-ray and we'll run some blood tests to figure out what's going on. And I was like, great. It's probably long COVID. I've probably got problems with my lungs, because at this point it was feeling like I was coughing a lot. I couldn't breathe. It felt like there was something inside my lungs, just like squeezing them, and it was a little bit painful as well. So I had the lung test first. I went to the hospital and had that done. And a couple of weeks later, they'd scheduled the blood test. So I went to get the blood test, and I was just chatting to the doctor, the nurse who was doing the blood test. I was like, oh yeah, I've had a lung x-ray because I think I've got long COVID. And she looked on the system and was like, oh no, the results for your lung test have come back and they're showing as clear. So I'm like, really? And she's like, yeah. And I'm like, maybe that's a mistake. So I waited until the results from the blood test came back and scheduled an appointment with my GP to discuss the results. And they're like, oh, I can see your lung test, it was clear and your bloods are completely fine. And I was like, what? Because I was so sure that there was a problem with my lungs, that like it must have been that. And around the time, about the week before this appointment, my cat had an operation, and she got really like mega needy, like clingy. She would not leave me alone at all. And I noticed that whenever she was like basically sat on me and like rubbing up against me all the time, I would get like hay fever symptoms. So I was like, oh, maybe I've got a small allergy to the cat. And I have developed a bit of hay fever over the last few years. And with the cat allergies as well, I started Googling just because I like to Google whatever symptoms come up. I'm always like, ooh, I wonder what this is. And it came up and it's like, oh, this is sometimes linked to asthma. And I'm like, So I looked into it because my mum and my sister have asthma, but it's not something I ever considered before. And I was looking into it. I was like, hold on, this fits all my symptoms. I'm like, So when the doctor said that the blood test and the x-ray were clear, I said, could it be asthma? And she was like, I was just about to ask you that. So yeah, basically I have asthma. Somewhere along the last few years, I developed mild asthma, and then COVID made it so much worse. Which is great that it's not long COVID, and that I have answers. So the doctor that I was on the phone with at the time, she's like, right, we'll prescribe you with some inhalers. She talked through like how to use them, what they were, and was just like amazing, and really helped me with that. So I got the inhalers, and I was a bit worried about using them at first because I have breathing problems and a bit OCD and paranoia about anything going in my mouth. But I did manage to use them. It's been about 3 or 4 weeks now that I've been using them, and I have the difference. It's absolutely amazing. I can breathe so much easier now. I'm not coughing all the time. My fatigue levels have improved, my energy levels. It feels like I was back to my almost back to my previous pre-COVID days. Honestly, I can't even the difference it's made. I never liked. I mean, when she said you'll need inhalers, I was like, oh, can I not take a pill instead? I really do not like inhalers. But I have to say, I love them now. Like, I mean, they taste a bit funny and they're not nice to use, but like, because of how much they've helped me, yeah, I just, honestly, it's wonderful. I've been able to start going out on walks again and not feeling like I'm dying. I'm able to do housework and not having to like take 2 days off to recover. It's helped my Emmy so much. It's just, honestly, I can't even. The last few years have been such a whirlwind. So many ups and downs. With COVID and health problems and getting all these diagnoses, it's just, I don't know, I feel like things are finally going in the right direction. Things are coming up like roses, basically. I'm getting the help I need. Doctors and nurses and everyone are being wonderful. I mean, you get the occasional like ignorant person who should know better. I mean, seriously, if you're working in a neurology department, you should know like about autism, and honestly, that was just shocking. But yeah, basically that's my life update. I've been just trying to get to grips with everything. It just feels like one thing after another, but like getting all these diagnoses and like being able to answer questions about my past and figure out what's going on with me, it's just, I feel like we're going in the right direction. So that's my life update. I'm hoping to be able to do more videos soon now that I've got my breath back, and now that my energy levels are better. I don't know, I just feel motivated to do things now. So yeah, hopefully I'll keep doing videos. That's my life update so far. Thanks for watching. Goodbye.